Well, good afternoon for all. I'm going to talk about my experience over more than 1,600 patients treated by Q-switch laser for tattoo removal. I am Dr. Perez Rivera from Buenos Aires, Argentina. This is my conflict of interest, but I will try to not mention any trademarks, only talk about technology, and all B&A are patients treated by me. I really believe in that. We all have the right to repent, life transform us. That's why tattoo no longer have to last forever. Our marriage, in some cases, no longer have to live forever. That's why we have the possibility to get improving the quality of life of our patients. We are able to say that a quarter of people around the world have at least one tattoo. This is true. This is a fact. And we are able to say that a quarter of them are going to rewrite it, and we look for a solution. There's a lot of potential patients. Please think about that. Quick for remember that it's really different, the action of photothermal act for millisecond or microsecond devices to the photomechanical effect of the Q-switch laser devices. A nano or photo or picosecond device, they all act for a photomechanical effect. And this is the gold standard for tattoo removal. Here it is an example of which need to do and we need to avoid. Here is the endpoint or classical endpoint of the Q-switch laser is frosting, and here is injury of the epidermis and dermis made by IPL. And how does the Q-switch laser have successful in the erasing tattoo? By the photoacoustic reaction. I love to put this example because all of us play with this, with the Pac-Man when we were younger. At least I play with it. In this case, our macrophages is the Pac-Man to try to eat the phantom is the ink, but the size is too big. That's why we need to help him to apply the Q-switch laser to reduce to little phantom from pebbles to sand to dust, and by this way, our macrophage eat it and thrown away by the lymphatic system. And here is the proof of that. And you can see here is the sequel of the treatment before, after the 4th session, and look the shadow in the 10th session. This shadow is the ink inside the lymph system going to the node. And by this way, we can prove that is the way of the macrophages throwing away our ink by the lymphatic system. Why we need at least 4 wavelengths? Because if you have only 2, it's the regular wavelength of any kind of Q-switch laser, you'll be successful over dark, of course, black, and maybe of red, orange, and yellow. But if you have 4 wavelengths, you can be successful in any color of the rainbow for sure. For example, in this mosquito tattoo, as you can see here, I have 6 different kinds of tone of ink. That's why I think to be successful, I have at least 3 wavelengths to apply during the treatment in this tattoo. But not all the Q-switch laser act in the same way. I remember that to remind you that nanosecond devices still have a photothermal effect. In some cases, can be a problem. For example, in some cases, you can have some scar reaction. If you have a pure photomechanical effect by the picosecond, you can avoid that. These are the 2 devices that I use. The first one during my first 7 years of tattoo removal, and the second one from 2017 until today. And until since 2011 and nowadays, I treated 1,607 patients, majority of them within my PECO period. If I give an average of 6 sessions per patient, it means that I perform more than 10,000 treatments in all my patients. All of data give me the possibility to publish this article, to measure the characteristics of my population. We rate tattoo regret and look for removal. And I found that majority of my patients are women and over an average of 30 years old with a high education level, more than close to a half have university or tertiary studies. Most of the tattoo are professional, more of them black, and more of them in exposed areas. It's classical on hands, arms, and shoulders. More than half of the patient express that they dissatisfied the main reason for erase tattoo, not for, as we think in a previous service that was by labor reasons. No, it's only by dissatisfaction of was main reason for erase the tattoo. Here I am in a classical sessions. I perform every 30 to 60 days. I have an average of session of 8 sessions for professional tattoo, an average of 4 sessions in amateur tattoo. Of course, it's painful treatment. You need to use cold gel pack, collar, in some cases anesthetic cream and anesthetic by injection. And you can choose between the 4 wavelengths, as you can see here, depending on the color of the tattoo. Always increase energy step by step to avoid any kind of reaction. And our endpoint is the frosting. You look for that. In the post-treatment recovery time, I only ask to put Vaseline. My results. Some tips or tricks. Well, best colors to remove are black and red for any kind of custom laser. The worst colors to remove, green and light blue, is take us a lot of sessions to try to be successful. Lot color, slow result, less color, fast result. Amateur tattoo is really easy to remove. In 4 sessions, you can be successful. It's not the same for professional tattoo. And more recent tattoo is slower to remove because we have a low quantity of ink. Closer the tattoo to the lymph node, faster to remove it. This is the classical sequence: first session, second, third, fourth, and the final 6th session. And in my nanosecond period, I'm going to show you some cases like this to complete removal on the hand. 8th session, complete removal of the chest. 8th session, the same on the back. This difficult tattoo over the abdominal area. 8th session can be successful. Color, 2 colors in the breast of the patients, 6 sessions. Yeah, and I start with the picosecond period. I mentioned that the menu à la carte, when the patient can request me to not take all the tattoo, even that only a part of them, and I can offer that to my patient, like in this case. In some tattoo, traumatic tattoo is easy to remove. Just in this case, only 1 session. Cosmetic tattoo, too easy too, only 2 sessions. Another cosmetic tattoo on the eyebrow, little more difficult, 7 sessions. A complete removal on the feet, complete removal on the underarm, complete removal 5 sessions on the abdominal area. Another complete removal on the forearm. 6 sessions in some cases. You can see here we obtain a shadow. It's only a matter of time because here there isn't any kind of ink. It's only a matter of pigmental reaction, hyperpigmental reaction. Complete removal. Another case. More cases. Difficult and huge tattoo on the back. And my result. This case is complete removal in 7 sessions. Another complete removal. Another one. And this is a sequence, a classical sequence. You can see here in the middle the way we can be successful in the middle part of the tattoo, and the limits the tattoo artist passed several times. That's why it's a little more difficult. Another complete removal, another one, more cases, another more on the back. Again, Emmanuel Lacarde, the patient requests me to leave the star and only erase the tattoo in the middle of them. And again, another Emmanuel Lacarde, a huge tattoo, and only want to keep the lines that you can see here. 14th session for difficult tattoo with a lot of ink on the forearm. A difficult tattoo with at least 5 different kinds of tone of colors, and if you can see here, we can obtain a hypopigmentation lesion, and maybe it's only a matter of time, or apply a CO2 to recover the normal color of the skin. Difficult tattoo is still in progress. This patient tattoo over this Becker nevus, and when we successful to remove the tattoo, the Becker's nevus appear, and well, we are thinking about to treat it or not. Is really recently patient. Here it is the funny mosquito tattoo and the way I can remove it. Another difficult with green tone, and the way after 12 sessions. It's not easy. I was successful. Another difficult tattoo with, again, green. It's the more difficult color with the light blue, and the way I don't complete the treatment because the patient disappeared, but was, for me, good enough. In some cases, the patient look for improvement for tattooing. They ask only to reduce the tone, and here is a successful treatment. Hemosiderosis, deposit of ferrum is iron inside the buttock of some patients by medical indication, and in some cases produce this hyperpigmentation similar like a tattoo, and the way we can be successful with a Q-switch laser. Yeah, exactly. And this is true. Best result and best BNA photos did a lot of time, because usually we have a PIH transitory, luckily, fortunately for us, but it takes a lot of time, not less than a year. I show you this patient before, but in the middle, we handle with that for a complete year. Another PIH and the control after a year. Again, another case, again, a control, in this case, 2 years. Another case, 10 months after we finished the treatment, and we said it's only a matter of time, and fortunately, that was happened. Again, 2 years of control and the complete removal, not only the tattoo and the PIH2. Difficult case because it had a light blue color, and when we apply 532, in some cases, we caused that, and hypopigmentation lesions, and when we apply the CO2, we were successful to recover the color in the area. Another case where with this transitory hypopigmentation lesion, and the way we can be successful using the CO2. As side effects, I showed this case yesterday as a really difficult case. When we apply the Q-switch laser, we change the tone of the iron ink from black to red, and the titanium from white to gray, and it's really difficult and take a lot of sessions to try to solve. In some cases, we obtain a skin texture change. This is true. We need to handle with that. Or leukoderma. In some cases, I add the CO2 to reduce this leukoderma too. Another case of leukoderma. This is not a problem for us. It's a problem for the ink. This is a classical allergic reaction to the red tone because it was made by mercury, and we were successful in little few sessions, only 3 in this case, and this another case, great reaction, allergic reaction, and we were successful. The patient again with tattoo with another color don't cause this reaction. In the post-treatment indication, usually I ask him for mastaining, sunscreen, and if I have the PIH, I indicate high inhibitors of melanization as kojic acid, hydroquinone, or tranexamic acid. There are different ways to get result improvement. There are, if you know, the R20 protocol. You wait 20 minutes and pass again the Q laser in the same patient, the same area. The use of PFD patch, shock waves, allogrative laser in some session or after, and the use of lymphophlebotomic too. I try nowadays to be successful with that. In conclusion, in my experience, the application of picosecond pulse wave cuts regular tattoo removal session by 20 or 40% of my cases and my sessions. For the removal of light colored tattoo pigments, for me is essential to have more than one wavelength. High peak of power is less unit of time is the best result. Look for that. Ask for the more powerful device that you can find in the country where you live. My first advice, look for the most powerful, faster, and versatility switches available. Ask for that. And my second advice, study the population of the place where you work and live, because 1 in 4 inhabitants have at least one tattoo, and 20% of them will look for elimination and modification of it. That's where they are all potential patients for you. Thank you so much. No, not at all. I only sit down. Yeah. Okay. ¿Quieres?
No.
¿Quieres abrirme este y yo le doy
Not
esto?
working. Oh,
Ok.
Gracias. Hola. 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 Ok. Doctor, le quiero preguntar porque los resultados, digamos, de la...
I wanted to ask, because the results in the superficial part of the skin are very nice. It's 1 year or several years afterwards. And if I wanted to ask if you use CO2 or any other technology to improve the skin surface after laser removal, tattoo removal.
Spanish? Okay. Sí.
Yes. I showed 2 of my cases, but there are other cases in which I am sure that I eliminated the color, and it helps me a lot with using CO2 because of the hypopigmentation. So I do associate it. Some colleagues use a protocol where in the same session they do CO2 and apply Q-switch. I don't find any sense in that because there's no affinity, because CO2 has affinity to water, so it's a lesion for the skin and it may leave a scar. So I don't do it that way. I use CO2 in the post, and I use it frequently to help with the texture and the pigmentation issues. And how long do you let it rest to do the CO2? Good question. No less than 2 or 3 months, because of course the skin is going to be a little hurt, and the patient doesn't want to be hurt again. So even I do this for free because I want the best result possible and the patient is happy. So it's nothing for me just to softly pass the laser a few times. I've understood with your conclusions that you have a lot of experience, and with the use of the nanoseconds, you take 20, 30, 40% more sessions to get to the same place. But in my experience, if you use picoseconds, you can get further and have less pigmentation or better. Or can you get to the same points with both technologies? With picoseconds, it's a lot faster. It's not pure, those picoseconds, that was in the lab, but the lasers of picoseconds, the faster you send the energy, the more disruption you obtain. The more disruption you obtain, the more easily the macrophages eats through it. Above these measurements, you can't do it because the capacity of the vessel is not adequate. If I lower it to 10, 20, 30 microns, it's easier. So quickly I can eliminate it. That's the cause that with picoseconds, it has reduced the amounts of sessions, and it does well. In terms of the depth, I couldn't be able to tell you. I don't know if the picoseconds would have any action there, because it's 1064, and they all have the same action. So for all of the depth, no. So I showed that case before, and I have another case that's really good with nano, but it takes longer. So in terms of penetration and wavelength, I have to look into potency.
Sanchez Castillo.